you talked about how you were able to successfully transition over into a training management role. Talk to us more about that, and how did you come about that opportunity? I know you kind of mentioned it briefly, but did you mention it previously before and it was like a track that you were on and you were just basically waiting on the role, or did you have to make some strategic steps? Talk to us about how you were able to transition over into that.
Yeah. So like we said, there's so much growth in clinical research. My line manager was like, do you want to go lead CRA route? Do you want to be a line manager? She was kind of looking to see, where do you see yourself in 5 years? What do you want to do?
Right.
And, like I said, I'm a glutton for punishment. So I wanted to stay a senior CRA. No, I'm just kidding. But no, I loved it. And so I was like, okay, I want to stay a senior CRA, but if something does come up in training, I am very interested. And at the time, I didn't even know we had a CRA training program. I knew we had a training department, but I didn't even know there was like a CRA training program at the time. And she had called. I was like, I remember I was in my backyard with the dogs and I was like, got this call like, hey, there's an opening in the training, the CRA training program. And I put you in for it. And then I interviewed for it and was offered the position. And I was really, really excited because it was a line manager position. However, I trained in that program. I was kind of like a line manager / coach. So, which I absolutely loved. It was a 12-week program that the CRAs went through and I would help interview the new CRAs coming into the program. To see who we would hire to come into the program, because they kind of came in as employees. They were considered trainees. And then after they graduated from the program, then they went in with their new line manager and became CRA ones. And so it was an exciting opportunity because I wasn't on the road. I was like, oh my gosh, this is a dream come true. I was actually working in my office. And the only time I had to go out on the road is if we had like a meeting with the manager, like a manager meeting that we all had to get together for. Or if someone needed like an assessment visit or they had to be signed off in order to perform a visit by themselves. And that happened when I had to, I was kind of thrown in, like if there was a bigger gap between classes, I had to be a line manager for like 6 months, onboarding those new CRAs and getting them ready. So that's where I had to do like the assessments and sign off. Yeah. And I was like, that's where I kind of felt like it was a trial by fire. Like I was kind of thrown into that. And that's where I was blessed. The same line manager, even if she was assigned to me or not, was like, let's meet up. Let's go over these different systems. Let me help you. I'm telling you, she was sent.
Oh, wow.
I mean, I wouldn't be where I am now if she wasn't in my life. I'll tell you. I mean, she was awesome and helped me to, to work through the different systems. If there was an issue that, it was my first time being a line manager. If there was an issue that came up with one of the CRAs, she helped me how to handle it. And even my other colleagues that were kind of thrown in were like, we're not getting that same support. And it was funny.
Wow.
And she even let them join calls with her. And she was always there, she was definitely a blessing for sure.
It's always nice when you have that person, right?
Yeah.
I've been blessed to have 2 people like that in my career. I had this amazing line manager. Angela Dennis, I have to say her name.
That was so cool.
She is just so amazing. And I honestly wouldn't be where I am today either without her. And then I also had, when I was a CTA, she wasn't my manager, but she was kind of like my mentor and she trained me on everything.
That's amazing.
Lam Calderon. And she's like one of those type A people, but in an amazing way.
Yeah. Yeah.
And she I wouldn't know regulatory documents the way I do if it wasn't for her. Like she literally went through it piece by piece, step by step of explaining every little document. And it's like having those people are key, right? In your career.
It is. They go above and beyond.
Yeah.
That's amazing. Yeah. And I'll say mine. Mine is Deborah Greer. No, she was the best line manager ever. No.
But no, like these people, they deserve to be recognized because it's honestly outside of their scope when it comes to their responsibilities, right? Yeah. So they're just taking on this extra role of really being a mentor and a coach, like you said. And it's truly a blessing. It really is.
It really is. Like I said, I wouldn't be where I am without her. She's such a blessing. And she actually had told me about, she wants to see me grow. So it was like, Even when there was downtime, the one time there was downtime, the company was offering to pay for different ACRP or SOCRA certifications. And she was like, you have the time. Do you want to do it? And I'm just like, oh my gosh, yes. Because, I was so busy on the road. I didn't have to have it to be where I was. Because as I keep going with my experience and was growing, I didn't have to be certified. But I didn't even have time to pursue it because I was constantly, on the road. And so I was like, you know what, after all this time, yes, I want to go for this, So I did it through ACRP and it was intense, but it was so worth it and an accomplishment. I was really happy with that too.
Awesome.
It was a blessing. She brought that up too.
Wow. That's awesome. That's amazing. So as one of the people that you're like now training entry-level trainee CRAs, and at the same time you're a line manager, and then interviewing potential candidates as well. Mm-hmm. What would you say that you learned throughout that role? That would be kind of like the top, or top 2 or 3 things that you learned throughout those roles that you feel like would be the most helpful advice to people that are aspiring CRAs that want to get into, their first CRA role?
Yeah, so definitely what I've learned as I'm training new CRAs, and definitely the first thing, and this doesn't even have to go with the training, is not to be afraid to ask questions. Because I feel like a lot of people think, well, I'm new. If I ask questions, they're going to think I don't know what I'm doing. And I'm just like, please ask questions. I was more worried if they didn't, and you never want to wing it, and to me, if somebody's not comfortable asking, that again, to me shows a sign of strength and integrity, that they want to do a good job and do it right.
Right.
So I definitely encourage people to ask questions and not try to wing anything. And definitely just being aware. And some of the tips I'm going with is because I noticed it when I was training the new CRAs after they graduated. And one of the things I also would tell them is just to be aware of all your deliverables and when things are due, and kind of give them tips how to manage their time and prioritize, because time management is an issue that even senior CRAs struggle with. Mm-hmm. So I would try to also, help give them tips with that, and setting reminders, and that, in clinical research, you're always getting an email or always getting something that's going to distract you, and you have to learn to adapt and reprioritize. So I definitely like to tell them, set reminders, because you don't want something to slip through the cracks. So we would work on that together. And then just, and also any tips I could give while they're on the road, like, hey, let's make a detailed checklist so you don't forget what you need to do while you're on site. And it's like, and I know they're overwhelmed. They're struggling with, I have a protocol, I have a clinical monitoring plan, I have all our company SOPs, and, I have, EDC completion guidelines and all this stuff. So it's like taking kind of all this together and making one detailed checklist, which for them as a new one, it's going to be very, very detailed, like to remind them, hey, when you're checking the equipment, make sure not to forget to check for calibration, things that as we're seasoned is kind of second nature.
Right.
And like, even when comparing documents, and the reg binder, like, make sure this is consistent with this and this is, so if they have to make something so detailed just to kind of help them, I always encourage that too, until it just becomes second nature. So preparing that ahead of time might take a while, but it'll be worth it in the end. So I like to help them with that too, and give tips for that.
Absolutely.
So,
and what would you say, from an interviewing perspective, what would be kind of like the top tip or top 2, 3 tips that you would give for people interviewing for these entry-level roles?
Yeah. So one of the things, so definitely for me, that I've noticed, of course, communication for sure, dressing professional, so those should be, pretty common sense, but, some people don't. Some people think, oh, it's, they're like, oh, it's just, remote. So I could get out of bed and come on the phone, but,
yeah. You have to put that in there too, because
so definitely treating it like you're in person for sure. But definitely for me is knowing, I've had some that really didn't even know really what the role was. Mm-hmm. Like, they might know, okay, I'm the first point of contact, between the sponsor and the site. But they really didn't know, like, hey, my job is to make sure that subjects are safe, that the data is valid. I'm there to make sure that sites are compliant. Like, mainly it was, I'm the first point of contact and I'm making sure they're doing the protocol right. But that's pretty much it. So really they didn't know a whole lot about the role. So I did notice that. So every time, like, I heard them talk about subject safety, my ears would ping like, okay, and you could tell who really knew like regulations versus those who didn't, like, because we did have to have some sort of experience before we would hire them. And so one of the things I noticed was, like, there was somebody that was a research nurse. So you think by her being a research nurse, and then I had someone else that had preclinical experience in the lab, which he was my star person. I thought when we were talking about going into oncology as a newbie, he taught me oncology stuff because he was a PhD in pharmacology.
Oh, wow.
Oh my gosh. He had a PhD in like pharmacology and would teach me stuff. Like, I would hear him go back and forth. I was doing assessment visits and he would go back and forth with the doctors. Like, I'm like just watching, like, this guy's amazing too. I'm so proud of him. He's like a senior CRA now. So I'm just so proud of him to this day. But so when I interviewed him, he, he didn't have clinical research experience, but yet this woman over here, she was a research nurse. So you think she would, well, she didn't even know what, GCPs were. And I was like, whoa, cause I'm thinking, cause everybody on the delegation log, we check to make sure, they have it.
Hey.
Yeah. So I was surprised. So, but then for him, he worked preclinical in the lab. He knew all about GCPs up and down, left and right. I mean, like, you can tell he did his homework. And when you know your stuff, you're also more confident, because I always say that even with my CRA foundation training, you do not have to have a training program to become a CRA.
Right.
If you can take it, it gives you that confidence, it's like, it's worth it. Knowledge is confidence for sure. But like, yeah, so she, didn't get particularly hired or, didn't get hired because she just didn't know GCPs, even though she had technically had the previous experience. She, didn't even know. And then actually they did give him a chance because he knew his stuff and, did have the PhD in pharmacology and all that lab experience. And it was all and all that lab experience was in oncology. I mean, the stuff he taught me about oncology, I was like, oh, it's like, I mean, it was so, yeah. So I was so proud of him, even to this day. He even sent me like a little 4-page checklist before his first PSV, and I'm looking through it because he wanted to make sure he got everything. And
wow.
Yeah, it's just so cool to see them grow,
Yeah. And I'm glad you shared that story because it gives the viewer an opportunity to see, like, to hear somebody that actually had clinical research experience, and then up against somebody that didn't, but the person that didn't got the job just because they knew their stuff and they did their homework, which I don't know what rock you have to be under for you to have clinical research experience and you don't know GCP. But I guess that explains why we go on site sometimes and we're like,
yep,
what?
I know. Like I had one coordinator that wasn't familiar with an AE. I'm like, what? Yeah, like,
how did you get this job?
I wanted to fall out of my chair, and it's, oh my goodness. And so I was, very surprised. So the only thing I could think of is if she was a research nurse that just administered drug or something. And maybe she didn't do anything else. I don't know. Cause I was like, how do you not know? But I'm not putting her down anyway. I mean,
right. Absolutely. But that's where homework comes in at, right?
Yeah. And actually they would have given her, I think, another chance. Like they were like saying like, hey, why don't you learn this or, study this more and then come back for an interview.
But that's one thing that I strongly encourage. And my coaching program strictly focuses on the career development side of things. But it's a nice segue into yours because you give like a really great overview, not too long, not too much, but just enough of the actual clinical research, monitoring, industry-specific terms, and the technical aspects of being a CRA. You give a well-rounded, I would say, perspective of that. So I feel like there's no excuse, especially with today's age. Like there's so many books out there that you can get.
Yep.
Like your course is one of them, and there's the gamut of the others. But I
Yeah.
want to strictly focus on yours, and talk to us a little bit more about how that came about, how you got that started, because somebody like that would be the perfect candidate for your course. It's something that they could quickly sign up for, right? Get access
Yeah.
to immediately,
Yeah.
and take that before the interview at the very least.
Yeah. Right. No, I'm just kidding. But, but it was so, but yeah. So the CRA helper came to be because, and I'll say it quick. Sorry. Because, with our companies, there's always mergers, and sometimes layoffs. And and I was in a non-billable role because I wasn't assigned to a project. So like line managers and, training managers, things like that, non-billable versus like CRAs, they're billable to a project. So we had, I think, a couple rounds of layoffs, and I wasn't affected by that. And then I want to say like around the third round the next year, I was, but I felt a peace about it. Like it was time. And they were such a blessing. They were trying to find another role in the company for me. They had I got a nice severance package, and I just knew it was time. And so, but clinical research training positions, though, isn't something you always see they're hiring for, because I really still wanted to do training. And that's when my sister-in-law was like, have you ever thought about developing your own course, to help? And I was like, okay. So then, I've told this story before where I was going to call it CRA Prep. And then that's when she was trying to help me find my domain name, and set up my website. She's like, okay, CRA Prep. And she's like, oh, no, you can't do that, because when you type it, it looks like crap rep. And so I was like, oh my gosh, no. So yeah, so I was like, I want to help CRAs, aspiring ones, new ones. So that's how the CRA Helper came. And so I started out with a podcast to help give advice and let's get clinical. And then I knew, and while I was doing that, I was trying to work on the course. So yeah, like you said, CRA foundation training, it just takes a click. They can enroll, and they'll get login information. It takes them right to the library, the dashboard, and they can take it. And it's about 8.5 hours of training. Like you said, it's the same style as the podcast, where it just kind of gives tips of things that maybe took me, like you said, years to learn while you're out there. If I could help you right away, kind of know what to look for and kind of hold your hand as you're getting started, that's what I want to do. So it kind of starts with the background of why we do what we do, from, the pathway a drug takes from lab to pharmacy, to our GCPs, the famous GCPs, to, and then all like a guide that lists like all the different acronyms that we use, because even not only clinical research has a bunch of different acronyms, but different companies might have their own acronyms for the reg binder or the delegation log. They have their own. So
it's like they want to keep you on your toes. They always come out with something new.
Yes. So like you said, I do that. And then I jump into like, what are the different types of monitoring visits? What do you do at each one? What's required? Why are they required? What are they? And then checklists for each type. And then it just keeps going deeper of how to do each task, and even what deliverables we have, preparing and following up on monitoring visits, time management, and how to become, and different pathways to take to be a CRA. So that's all packed in about 8.5 hours. And so like you said, taking that could help. And I'm not trying to push the course by any means. You don't.
Oh no, definitely.
But if, like you said, it could build that confidence, because when they start rattling stuff like, so do you have EDC experience? Do you have, you might be like, well, I was a coordinator, but I didn't do that every day. We had a data entry coordinator, so you might feel like it just kind of helps,
Absolutely.
Yeah.
And that's what I love about your course, because it's not like, like you can get a clinical research degree, or you can take some of those other courses or programs, and it's like weeks or months or, what have you. The way yours is designed, it's like you have no excuse, because you can take it from anywhere. It's a reasonable amount of time, and it gives you like just enough so that you can, and since we're focusing on aspiring CRAs, so that's why I kind of keep bringing it up as for the interview. But really, it could be refreshers for CRAs as well. But for the aspiring CRAs, I feel like it's important to know what you're getting into, and I feel like this course gives you a good look into, okay, what does this entail? Because like you say, most people don't know. And you won't really know until you start, but at least you can have a better idea other than
Exactly.
Enforcing the protocol or whatever they think.
No, like you said, definitely there's so much more. And and I've heard that because one guy that took it, he said he had experience as a CRA and as a coordinator. And he said, well, technically, he goes, I think it helps as a coordinator too, because you're seeing what the monitors are looking for, and what their responsibilities kind of are, and stuff. So he liked it from both sides, and then of course, sometimes you have certified ACRP or SOCR certified coordinators. So it's like, and if they want to be a CRA, it's like, okay, I'll get my continuing education points while I'm taking it. And then I can learn how to be a CRA on top of it. Cause I contacted ACRP and SOCR just to see if it could count. Cause I'm always scrambling for points when I have to get mine. It's like you have a whole 2 years, but then the last month or the last week, I'm like trying to take it all. So it's kind of different than what's out there. But like you said, if it could help give it, just quality so close to my heart. I mean, I'm sure, coming behind other monitors, sometimes the disasters you come behind, and so I like to give tips to kind of show them the right way, not to learn bad habits, and just kind of, So that's kind of my goal, is to gain confidence. And then, like you said, help the aspiring CRA to know what they're getting into and give them tips for success from the get-go.
Yes, because even though companies train and we have these training roles, it's like, it's just so much to learn and so much to know that having additional trainings like this will always be to your advantage.
Yeah.
So yes, and you didn't officially give us the web address where everybody can go and enroll.
Yeah, so it's on my website. So the CRAHelper.com, I figured that'd be the easiest one to say. The CRAHelper.com. And then, it's right on the page. It shows the different platforms for the podcast. And then if you click learn more, it has the area that they can go to click to sign up for the course. And it gives all the details of all the modules, because I know I kind of flew through it. And then it shows the quintessentials CRA supplies they can get for free too. For signing up. I was in love with that stuff. I was like, I wish I had that when I was on the road. So all that's on my website at the CRAHelper.com.
Okay. And you said that the podcast, they can go there to get access to the podcast as well. And it
has all the links to all the different platforms it's on, like Apple, iTunes, and what was the other one? Oh yeah, like Spotify, Stitcher.
Okay.
Stuff. Yeah.
Just briefly, you tried to throw the podcast in there. You didn't really, give us too much details on it. But share the podcast name and, how often are episodes available? Share some of the things you talk about. You kind of just.
Yeah. So it's called Let's Get Clinical, Tips from the CRA Helper. But I started that first because I thought, if I come up with a course, people are gonna be like, who's this girl? Who's this person? So I felt like I should get to know people and give tips through the podcast. And so I have 21 episodes now. I kind of took a break from it, once I started focusing on the course. And so it goes from the intro of the path that I took to kind of share, this is the path that I took to get, my foot in the door. And then it goes to travel tips. There's 2 episodes regarding travel tips, and time management. And then also, things that could prepare them, what are some of the common audit findings? And then, explaining, there's multiple episodes of that, from consent issues to AE/SAE issues to the essential documentation. So it goes all the different common audit findings and tips and that review. And then I even had Jasmine Smith on an episode that gave tips on monitoring during COVID. So because I was off the road, so I was very, very, very curious, what you guys were going through out there on the road with COVID and everything. So so she gave tips there and she offered a checklist for people to prepare for visits during COVID. And then what are some of the other ones? I know you think with 21 episodes, I would have more
No,
confidence. But yeah.
no.
And like tips in writing trip reports, things like that.
But basically kind of a wide range
Yes.
of different types of tips, advice on monitoring, being a CRA, how to have a successful CRA career, things of that nature.
Yeah. Yeah. Whatever I could do to help. Cause like you said, it takes, we might get trained at the beginning, but, learning that stuff, I mean, it might take years for us to learn it. And so if I can kind of help right away, I want to do that.
Absolutely. That's awesome. And all of that you can find on CRAHelper.com.
Correct.
Right?
Yep. Correct. Yep.
Okay.
I said that twice, but yeah.
I want to make sure people can access this because it's amazing. And not only that, I feel like it's at a great price.
Thank you.
So you can't hear, these excuses about I can't afford this or that. Because it's something that if you truly, truly, truly want to be a CRA, you have to be willing to invest in yourself. And this is one of those things that I feel like is really a no-brainer. If you have to save for it, whatever you have to do, because you don't want to be that person that goes into the interview and doesn't know what GCP is. Like, you don't want to make it that far and that be like the reason you blew it.
Yeah, no, you're right. Because it's hard enough just to get your CV notice and contact interview.
Yeah.
So to get that far, it's like, be prepared.
Be prepared. If nothing else, you should be prepared for that moment. I always, all the people that I coach, I told them that every time you speak to somebody is your opportunity. That's an interview. So you have to be prepared. Good. You have to prepare beforehand so that you don't have to get prepared when it's crunch time, because that's if you're already behind the curveball, right? If you're waiting until the day before, even the week of the week before, you have to start prepping now.
Exactly.
And doing things like taking this course is key. And not only the course, but then your podcast, I feel like it complements it. So it's like that ongoing support. Now there are some other things that you do too, as well, some other services that you provide, right? With like, I don't know if you still do it, but like resume, interview prep, some things like that, right?
Yeah. So sometimes, on the same page, like at the bottom is like, sometimes people sign up for like coaching calls or, like CV review. They'll send me their CV and I'll review it and send feedback, electronically. And then we'll talk about, like, have a follow-up call and talk about that. So so people sometimes schedule that too. And then, like you said, and in that they'll ask for like interview prep questions and, so we'll kind of go back and forth and practice and give tips with that too.
Awesome. I feel like I have to pull this out of you. Like you don't want to share, you're just hiding it. But I do the same thing, so I get it. But
I'm like, I don't want to sound like salesy or like,
no. People need, like, literally, they need these things and they don't know where to go. So I'm talking to you, but I'm talking to me at the same time.
Yeah, no, I get what you're saying.
Like, you can't hide because they're literally crying and begging for help. And you are like this amazing resource. And not only that, but you love what you do. You love training people. You love helping people. Like, it's literally a passion. So for you to have the experience, the knowledge, the information to help, and then at the same time have the passion and the desire to help, I mean, what better place for people to get help?
Oh, I'm going to cry. But yes, I definitely want to help people get their start and to be confident, because it just makes me sad because they might get hired. And I've had some that are like, that are just new and, new CRAs, and they want to get confident in the role. So, and sometimes they may be trained on that particular study, but just general monitoring questions, they kind of struggle with. So, so if I can help, definitely want to help.
Yeah. And a lot of times they don't feel comfortable asking their line manager or even a study colleague or whoever, just because they feel like this is something they should know, or they're embarrassed, or like you said, they don't have the confidence. So being able to take your course, being able to schedule a call with you, I feel like is key. And I don't cover these things.
It's so cool. We like, it's like we complement each other because like we each do something different.
Yes, I strictly stay on the career development side.
That's awesome.
I
And
feel
I've
like
told
the
people
other
about you.
side, say that again.
Oh, I was gonna say, and I've told people about you because when they want to get their start, I'm
Oh
like,
yeah. Thank
and I was
you.
like, you need to follow Jasmine. I was like, she can, it's like, because I might train on the monitoring. I was like, but she can help, develop,
Thank
get ready
you.
for, and rebrand yourself.
Thank you. Yes.
Yeah.
Because I feel like the other side is so hard.
Yeah.
Um, I mean, it's complicated. It's a lot of, and then you know how it is. Industry is constantly changing. There's so many moving pieces. It's
Yes.
hard to train somebody how to be a CRA. So I get why it's hard to get in the industry. Um,
Yeah.
and then once they're trained, like the sponsor still has to prove them to get on the study. So that's a whole
Yes.
nother beast.
Yes.
So it's like all these moving components and pieces to going from CTA or study coordinator or even in-house CRA to
Yeah.
CRA. It's like it's a lot of behind the scenes stuff that goes on that people just don't realize.
Exactly. Exactly.
Um, so I know we've covered a lot today. We have, and I'm so excited that everybody got to hear your story of how you went from, you know, not, going into school thinking you started out with optometry, and then
Yeah.
all the way over into CRA and then line management / trainer. And now you have this beautiful course. And, you offer coaching and you have a podcast. I mean, I feel like I always tell people that CRAs are really like that entry level role to the rest of your career, because from there you can go wherever, really, right?
Yeah. I mean, there's so much growth in the industry. And so, yeah, I mean, oh my goodness, like you said, project management, quality assurance, line management, associate director,
Whatever, right?
area, regulatory compliance, whatever.
Right. And there's even people you can go onto that director track.
Yeah.
There's even some people that have gone into the C-suite and taken executive roles as like VPs.
Yeah.
So it's like the sky's the limit, right? Wherever you want to go. Wherever you want to go. So final words for the people that, they've been struggling to get in, they're ready to give up, they've done everything they can. Maybe they have no experience, maybe they have some, and, maybe on paper they look like the perfect candidate, but they still just haven't had the opportunity. What would you say as your last words to those people?
And, like you said, their CV could be ready because like you said, have your CV ready for when you do see that opening. So like you said, they might look great on paper. And if you don't see current openings, like I said, with my opportunity, you never know with a CRA or a CRO, what new projects they'll be awarded. And then they have to fill those roles. So on a day-to-day basis, things change. So signing up for those email alerts and even not even just email alerts within the companies of jobs, but like even like ZipRecruiter and Indeed.com. Some things I'll even get and I'm like, oh, I didn't even know this company existed or this role existed, and so definitely always looking at, and like you said, not giving up and being prepared. So when that interview is, whenever you do get contacted for that interview, you're not scrambling and trying, because if you're prepared and know everything in practice. I mean, I was vacuuming and practicing, how to enter, like some answering questions and stuff, but being prepared is so key. And everything in clinical research, but especially, before you're contacted for an interview. Because like you said, you got that chance. So once that CV is noticed and you're contacted, then just be ready and just, and having that communication and knowing the industry, knowing the role, knowing the job description, so that is because, they're going to go off that. And knowing what's on your CV too, because they're going to look at your CV and ask about previous roles and things like that. But just never giving up, because like you said, we've never had there's probably not two people with the same story of how they got into the industry. And sometimes we have to take that role that is that stepping stone, and it'll be worth it in the end. Even if, I've had some people that even took a pay cut to get that research experience over here. And then it was worth it. Oh my gosh. Once they started moving up, it was worth it for sure. So just not giving up, signing up for email alerts, And you never know on a day-to-day basis what new job opportunities will come if they're awarded a new project. So I think that's it. No, I hope I included everything.
No, thank you. Thank you so much. This has been a very, very wonderful conversation. I've enjoyed speaking with you. You shared so much. I'm sure everybody is going to get so many takeaways. And the main, well, I'm not going to say the main because you said a lot of wonderful things, but one of the takeaways I want to kind of bring home is for people to go and really check you out. Seriously.
Oh, thank you.
No, seriously, at crahelper.com, and your podcast and your course, and really take advantage of it. Because it's the way the industry in general, I guess it's not even just our industry, but job searching in general. There's the times of where you go to school and get a bachelor's and then get a job.
Yeah.
And, you just apply or you just make a phone call or walk in, whatever. That's over.
Yeah.
You really have to take advantage of that outside training and invest in yourself at the next level to really get these opportunities. And your course is one of those things that I highly and strongly recommend for everyone to take advantage of. So yes, please go and buy the course, the podcast, please subscribe. And then follow you as well. You're on LinkedIn.
Yeah. Yeah.
Any other places that we should be looking for?
LinkedIn and Instagram are the main ones. I have, I'm on Facebook too, but mainly I'm on LinkedIn and Instagram too. Yeah.
Okay.
I said Instagram twice. No, but yeah, but yeah, those are the two. And it's at the CRA Helper. It's the same.
Okay. So yes, LinkedIn, Instagram, please go follow Elizabeth today. She has a wealth of information to share. And thanks for joining us.
Thank you so much. Again, it's been a blessing to be here and I love what you do. It's cool how we can complement each other, and I just thank you for having me and it's been a blessing. Thank you.